Hi, Kanza. I understand you have a new patient to present.
We have a patient who is a 2-week-old female named Ashley, brought in by her mother to the clinic. Her temperature was taken at home rectally. It was 101. The mother complains of mild nasal congestion and also some fussiness in the morning. She also says that Ashley has been breastfeeding well for about 20 to 30 minutes every 2 to 3 hours, and she also has been wetting about 6 to 8 diapers per day. The mom also denies any vomiting or diarrhea. She says that she hasn't given the baby anything for the fever and that Ashley was healthy prior to this illness. And when we checked her past medical history, we saw that Ashley was born at 39 weeks to a 27-year-old G1 mother. Her mom had good prenatal care. She had a pregnancy without any complications. She had a spontaneous vaginal delivery without any complications. And her prenatal labs, including GBS, hepatitis B, gonorrhea, chlamydia, and HIV were all negative. The patient's blood type is A positive, antibody negative, and she has a normal newborn stay. And Ashley lives at home with her mom, her stepdad, and her 6-year-old stepbrother. There's no smoking, alcohol, or drug use in the home, and there are no pets in the home as well. Her maternal grandfather has type 2 diabetes, and her stepbrother has had a cold for the past couple days. And the mom reports the baby has had a fever and has been fussy but consolable. She also says that she has had some nasal congestion and some discharge from her left eye since her birth. She is still drooling like normal. She has a mild cough, but she has no trouble breathing or any cyanosis. She has been eating well. She has had no vomiting, no diarrhea. She has been producing good wet diapers. Mom didn't notice any abnormal movements or any seizures, and she also said that Ashley has some dry skin that comes and goes, but there are no rashes or any jaundice. Then Ashley has also passed her birth weight. Today, we took Ashley's physical exam, and we noticed that Ashley was 3.8 kilograms. She's 53 centimeters long, and her head circumference is 36 centimeters, all of which are normal for her age. And her temperature is 101.4 rectally, her heart rate is 170, her blood pressure is 84/42, and her respiratory rate is 36. She's sleeping in her mother's arms. She's in no distress. She's a bit fussy, but she is still consolable, and her anterior fontanelle is soft, open, and flat. She has moist oral mucosa. She has nasal drainage that is clear. Her tympanic membranes are also clear bilaterally, and she has some crusting in her left eye. She has pearl. She has positive red reflex, and her conjunctiva are normal. We checked her lungs out. Her lungs are clear to auscultation. There are no rales, no wheezes, no rhonchi, but we noticed that there are some referred upper airway noise. She's mildly tachycardic. She has normal S1, S2. She has no murmurs, no edema, normal capillary refill. She has also good peripheral pulses. The patient's abdomen is also soft, non-tender. She's non-distended, she has no masses, and she has normal bowel sounds. We noticed that she has normal female genitalia. She's at Tanner stage 1, no lesions, no discharge. Her skin is warm, dry, pink. There's no jaundice, no rash. She has some areas of mildly dry skin, but no lesions. She's moving all 4 extremities normally and symmetric. There are no deformities noted. She has good muscle tone. Her reflexes are 2+ throughout, and her prenatal reflexes are intact. Her first newborn screen was negative.
Okay, what is your plan?
For the assessment, we realized because of her age and her fever, she has an increased risk for a serious bacterial infection. So we're thinking about admitting her to the pediatric floor for 48 hours to rule out sepsis. We're going to draw labs including UA, urine culture, CBCD, blood culture, her LPN culture, and her RDVP. And we will also begin her IV antibiotics as soon as the cultures are drawn.
Okay, sounds good.